Assessing the ears and hearing. Equipment. Tuning fork. First, prior to performing the procedure, introduce self and verify the client's identity using agency protocol. Explain to the client what you are going to do, why it is necessary, and how he or she can participate. Discuss how the results will be used in planning further care or treatments. Provide for client privacy. Inquire if the client has any history of the following: family history of hearing problems or loss, presence of ear problems or pain, medication history, especially if there are complaints of ringing in the ears, hearing difficulty, its onset, factors contributing to it, and how it interferes with activities of daily living, use of a corrective hearing device, when and from whom it was obtained. Position the client comfortably, seated if possible. Inspect the auricles for color, symmetry or size, and position. To inspect position, note the level at which the superior aspect of the auricle attaches to the head in relation to the eye. Palpate the auricles for texture, elasticity, and areas of tenderness. Inspect the external ear canal for cerumen, skin lesions, pus, and blood. Assist the client's response to normal voice tones. If the client has difficulty hearing the normal voice, proceed with the following test and perform the whisper test to assist high frequency hearing. Tuning fork test. Perform the Weber's test to assess the bone conduction by examining the lateralization sideward transmission of sounds. Hold the tuning fork as its base. Activate it by tapping the fork gently against the back of your hand near the knuckles or by stroking the fork between your thumb and index fingers. Place the base of the vibrating fork on top of the client's head and ask where the client hears the noise. Next, conduct the rinse test to compare air conduction to bone conduction. Hold the handle of the activated tuning fork on the mastoid process of one ear until the client states that the vibration can no longer be heard. Immediately hold the vibrating fork prongs in front of the client's ear canal. Push aside the client's hair if necessary. Ask whether the client now hears the sound. Sound conducted by air is heard more readily than sound conducted by bone. And lastly, document findings in a client record using printed or electronic forms or checklists supplemented by narrative notes when appropriate.
So prior to performing the procedure, introduce self and verify the client's identity using agency protocol. So explain to the client what you're going to do, why is it necessary, and how or he or she can participate. Discuss how the results will be used in planning further care or treatments. So next is to perform hand hygiene and observe other appropriate infection prevention procedures. Then provide for client's privacy. Inquire if the client has any history of the following: allergies, difficulty breathing through the nose, sinuses infection, injuries to nose or face, nosebleeds, medications taken, and changes in sense of smell. So after asking, we will position the client comfortably seated if possible. So inspect the external nose for any deviations in shape, size, or color and flaring or discharge from the nares. Lightly palpate the external nose to determine any areas of tenderness, masses, and displacements of bone and cartilage. Next is to determine the patency of both nasal cavities. So ask the client to close the mouth, exert pressure on one nares, and breathe through the opposite nares. So repeat the procedure to assess the patency of opposite nares. Next is to inspect the nasal cavities using a flashlight or a nasal speculum. Next is to observe for the presence of redness, swelling, growth, and discharge. After assessing the nose, we'll move to the sinuses, so palpate the maxillary and frontal sinuses for tenderness.
Lightly tap over the frontal sinuses and over the maxillary sinuses for tenderness. Trans-illuminate the frontal sinuses by holding a strong, narrow light source snugly under the eyebrows. Trans-illuminate the maxillary sinuses by holding a strong, narrow light source over the maxillary sinus.
Document findings in the client record using printed or electronic forms or checklists supplemented by narrative notes when appropriate.
Step 1. Prior to performing the procedure, introduce self and verify the client's identity using agency protocol. Explain to the client what you're going to do, why it is necessary, and how he or she can participate. Discuss how the results will be used in planning further care or treatments. Step 2. Perform hand hygiene and observe other appropriate infection prevention procedures. Step 3. Provide for client privacy.
Step 4. Inquire if the client has any history of the following: routine pattern of dental care, last visit to dentist, length of time ulcers or other lesions have been present, denture discomfort, and medications client is receiving. Step 5. Position the client comfortably and seated if possible. Step 6. Inspect the outer lips for symmetry of contour, color, and texture. Ask the client to purse the lips as if to whistle. Step 7. Inspect and palpate the inner lips and buccal mucosa for color, moisture, texture, and the presence of lesions. Apply clean gloves. Ask the client to relax the mouth and for better visualization, pull the lip outward and away from the teeth. Grasp the lip on each side between the thumb and index finger. Step 8. Inspect the teeth and gums while examining the inner lips and buccal mucosa. Ask the client to open the mouth and using a tongue depressor, retract the cheek. View the surface buccal mucosa from top to bottom and to front. A flashlight or pen light will help illuminate the surface. Repeat the procedure for the other side. Examine the back teeth. For proper visions of the molars, use the index fingers of both hands to retract the cheek. Ask the client to relax the lips and first close, then open the jaw. Inspect the gums around the molars. Observe for bleeding, color, retraction, pulling away from the teeth, edema, and lesions. Step 9. Inspect the dentures. Ask the client to remove complete or partial dentures. Inspect their condition, nothing in particular broken or worn areas. Step 3. Inspect the surface of the tongue for position, color, and texture. Ask the client to protrude the tongue. Step 11. Inspect the tongue movement. Ask the client to roll the tongue upward and move it from side to side. Step 12. Inspect the base of the tongue, the mouth floor, and the frenulum. Ask the client to place the tip of the tongue against the roof of the mouth. Step 3. Inspect the hard and soft palate for the color, shape, texture, and the presence of bony prominences. Ask the client to open the mouth wide and tilt the head backward. Then depress tongue with a tongue depressor as necessary and use a penlight for appropriate visualization. Step 14. Inspect the uvula for position and mobility while examining the palates. To observe the uvula, ask the client to say ah so that the soft palate rises. Step 15. Inspect the oropharynx for color and texture. Inspect one side at a time to avoid eliciting the gag response. To expose one side of the oropharynx, press a tongue depressor against the tongue on the same side about halfway back while the client tilts the head back and opens the mouth wide. Use a penlight for illumination if needed. Step 16. Inspect the tonsils behind the fosses for color, discharge, and size. Step 17. Remove and discard gloves and perform hand hygiene. And last step, document findings in the client record using printed or electronic forms or checklists supplemented by narrative notes when appropriate.